Hi everyone, my name is Dr. Narjust Duma. I'm an assistant professor of medicine and a medical oncologist that specializes in thoracic malignancies. We are focused on women with lung cancer. Today, I have the pleasure to talk with you about complementary therapy for patients with neuroendocrine cancers. I want to thank the organizing committee for the invitation. This is a subject that's often overlooked and not explored, despite many of our patients um, taking complementary medicine or integrative medicine. As per next month, my affiliation will change to the Dana-Farber Cancer Institute and the Law Center for Thoracic Oncology at Harvard Medical School, where I will be also the Associate Director of the Cancer Equity Program. These are my disclosures, which include advisory and consulting, as well as speaking engagements. Healthcare can be very complicated, particularly associated with cancer care. Our healthcare system is just full of dead ends and like U-turns. And when you try to search for information about complementary alternative or integrative medicine, that pathway becomes like the pathway on the blue and this slide. It can be very confusing, it can be very challenging, it can be very expensive. So I hope we can talk a little bit about what is complementary medicine and how these can be part of your journey in your cancer treatments. First, we need to talk about the difference with alternative and complementary medicine. They are different, and they're often used interchangeable when they're not. So, alternative medicine uses the term that patients and caregivers are using a treatment instead of the conventional treatment. It means it's an alternative. So, instead of getting, for some patients, chemotherapy, the patient pursues other types of therapy and does not get a standard of care. Complementary medicine is a different term and is a term that applies to what most patients with cancer do, which is medications and other techniques in which supplements the standard of care. The standard of care is what has been proven by clinical trials and by studies that helps our patients with cancer. So alternative is one instead of the other. Complementary is we are complementing the standard treatment. So, complementary and integrative medicine are the terms that are approved and we're using more and more. Complementary medicine is the one that we're more familiar with. Integrative have the same concept in which is incorporated to the standard of care and is complemented to the conventional approaches. And this is what we're going to be talking about today: complementary and integrative medicine. Understanding that these ones are here to support you during your cancer journey. So, what includes complementary and integrative medicine? Include many, many things. It goes from supplements, procedures, techniques, and medications that helps our patients during their journey for their cancer treatment. Some of the more well-known includes acupuncture, herbs supplements, massage therapy, meditation. But there's also many other techniques that comes from outside of the country or we in our country that helps our patients during their journey. So there is no clear cut of something being complementary medicine. What defines what is complementary medicine is what our patients use to support them during their treatment. Something unique about complementary medicine is that it's very linked to our beliefs. It's linked to our culture. So you may see practices are very different in the United States because our beliefs and our healthcare practices vary based in our ethnic background, based in our religious background, based in previous exposures during travels. So I may have many patients that have the same disease, in my case, patients with thoracic malignancies, but their beliefs are different and how they see complementary medicine is different. So for this case, there is no one remedy that is good for everybody because we know that complementary medicine is really linked to our culture. And these tea and these practices are linked to or how did we grow up, where did we grow up, and what do we believe in. And I'm mentioning this because it's important that there is no one complementary medicine better than the other. And unfortunately, many of them have not been tested in a clinical trial and a very strict scientific criteria. So the appropriate term is integrative oncology. Is the appropriate term describing all these remedies, supplements, and techniques that are here to support our patients and provide a holistic and multidisciplinary cancer care. Our patients are not defined by their disease, and we're here to help them during that journey. And one of the things that I want to encourage everyone is to have a very honest conversation with your doctor and anybody in your healthcare team about complementary medicine. There is no judgment. There is nothing that we will say is wrong. We just want to know to make sure these medications don't interact with your therapy. We want to know in case you have side effects and they may be secondary to the complementary therapy. And finally, we also want to make sure that you are safe, not only physically, but also emotionally and financially, as complementary medicine is associated with a lot of financial toxicity. And we're going to talk about that. So, how can integrative or complementary medicine help our patients during the cancer care? Well, one of the things that it helps control the symptoms that the cancer treatment produces, the side effects of the radiation, the side effects of the chemotherapy, potentially side effects of surgery. It also helps with the stress related with cancer treatment, and also helps many of my patients feel like they have a little bit of control. Cancer disrupts everything: family relationships, lifestyles. So, complementary medicine has the good side that my patients feel they have more control and they're doing something more, a little bit more to help their health. And he also proposed own wellness. Many of my patients did not had a very healthy lifestyle until the diagnosis of cancer. So this complementary medicine allows for general wellness. There's many other reasons why people use complementary medicine, and because complementary medicine is linked to our belief, to our culture, those reasons vary from person to person. And we are not here to judge, we're here to listen, to understand, and to work together. Because it's your journey, it's your cancer journey. And as your doctor, I'm here to guide you to the journey and to make decisions together. And complementary medicine is part of what you believe. So what are some of the benefits of complementary medicine? There has been studies about several of them, and we're going to talk about what we know more. So we know a lot about acupuncture, particularly in patients with breast cancer, but we're more and more learning about other patients. So it can help with chemotherapy-related anxiety, chemotherapy-related nausea and vomiting. It is important that we practice strict clean needle procedures, particularly now during the COVID-19 times. Ginger, I'm a big fan of ginger. Ginger helps control nausea secondary to the chemotherapy. It has to be used in conjunction with anti-nausea medication. My patients are big fans of candy ginger that you can buy anywhere, and it helps them with the nausea induced by chemotherapy. Yoga, limited studies, many studies in breast cancer suggest that yoga will help with distress, anxiety, depression, and the overall stress that our patients face with cancer. Other mind and body techniques: biofeedback, hypnosis. Some of my patients have used hypnosis to quit smoking and also help with their stress. Meditation techniques can help deal with some of the secondary or the side effects of cancer-directed therapy. And I like the practical aspect. So many of my patients are very cell phone savvy. I specialize in women with lung cancer. And I ask them to download Headspace or any other platform they have for meditation. No specific disclosure with that particular app, but I say when you're waiting for your scans, you can try to do a 5-minute meditation. When you're waiting in the waiting room, you can do a 10-minute meditation. So there's that practical aspect of complementary medicine. Do you want to get massage on the weekend? Do you want to go for walks? Those things are complementary medicine, and I really like it to incorporate it into the treatment. What about bringing the ginger to the chemo suite? I have patients that do yoga when they're getting the chemotherapy, of course, with communication with the nurses, and helps them the time that they're in the chemotherapy suite getting the infusion go faster. Massage therapy has helped relieve symptoms, depression, anxiety secondary to cancer. It is important that you have a good communication with the massage therapist, and there is avoid areas like where the skin is sensitive due to radiation, tumor areas. And you have to be careful about deep tissue massage, particularly if you're in chemotherapy due to the high risk for bruises. When can you use complementary medicine and integrative medicine? Well, you can use complementary and integrative medicine anytime during your cancer journey. During cancer prevention, some of my patients use hypnosis to quit smoking. Early detection and diagnosis, a lot of my patients use techniques to help when they're waiting for a biopsy. That helps with the anxiety associated. During treatment, you can use the our essential oils that you can smell to help with the nausea associated with the chemotherapy, to help sleep when you are in steroids for some reason for your treatment. And at the end of life, complementary medicine is important for getting a spiritual health. It is a part of complementary or integrative medicine. It's what we use to make the journey easier and complement the standard of care, because we have to see our patients as a whole. And many of these aspects of care are forgotten, and they're very important. I'm a big proponent of many of these little tricks that make our patients tolerate therapy better, like do dishes with gloves, or um, use certain smells in the house, because the journey is long and is exhausting for many of our patients. So there are risks with complementary medicine. The main risk is that some of these dietary supplements, they're not controlled by the FDA. So some of them may be imported and it's not clear of the composition. And some of them may be very harmful. I lost a patient due to a supplement that came out of the country due to liver failure. So it is important that communication is there with your healthcare provider, with your pharmacist, to make sure these supplements are safe when interacting with your chemotherapy. There's a lot of pseudoscience that say, oh, this will be fine, but you need to make sure that your team knows about it. Particularly interactions. Some of these supplements may prevent the chemotherapy or the target therapy from being eliminated. So the medication stays in your body longer than they used to. And then you have very long lasting side effects. It is important that we don't delay or avoid conventional treatment, because some of this complementary medicine has not been proven to help the cancer. They will help you, but they won't help the cancer. So delaying or avoiding conventional therapy needs to be very carefully discussed. And finally, financial toxicity. There's a lot of pseudoscience, and there's a lot of people that wants to help our patients, and we suggest certain complementary medicine, but these are not covered by the insurance. They tend to be very expensive, some of them, and some of them are harmful, and they're very expensive. So we already have a lot of financial toxicity in cancer care, and if you are not careful with this complementary and integrative medicine, then our patients can have tons and tons of debt secondary to these complementary magical medications, when in fact they have not been proven. So we have to be very careful. If something sounds very good, it's probably not. And these pictures just to reiterate that financial toxicity needs to be to take into account with complementary medicine, because it can get very expensive, and it can add to the burden later on and may don't help you. So have a communication with your doctor to make sure that medication doesn't interact, and be very careful about the pseudoscience, which is the claims that have not been proven of certain therapies to cure the cancer or to shrink the cancer. This is a few clips about supplements. High certain herbs like the kava herb has been associated with liver damage, and which patients die of liver failure. High dose B carotene actually increases the chances of lung cancer. And these are just a few examples of what can be dangerous. Some supplements can make the skin very red, particularly the size of radiation. So some essential oils that are too concentrated can burn you if you put them right where you were radiated. And it can be very painful, and I have seen second and third degree burns with that. And there's also a lot of herbs that will interact with your therapy. For our patients with neuroendocrine cancers, they have a lot of oral agents, like some oral chemotherapies, like capecitabine, like temozolomide, everolimus. Some of these herbs can interact with these drugs, and they can, one, decrease efficacy, so it won't treat your cancer, and two, can make it very toxic. Coming to an end, I think it's very important that we know that these can interfere with chemotherapy, radiation, and other medications. You have to have an open line of communication with your doctor. There is no judgment. I see complementary medicine as a good thing. My patients do very well. I encourage them to read about it. And if you have a good relationship with your oncologist, there are things that you may try that your oncologist will learn. I learned about witch hazel for the rash induced by immunotherapy from a patient, and that's just complementary medicine. So we are a team, and there is no wrong or right, we are together. We just want to make sure that they doesn't interact or makes your treatment not work. And finally, the special considerations for patients with neuroendocrine cancers. Some of these cancers they produce hormones, and some of these complementary medicine can also produce hormones. So we want to make sure that the hormone that we're trying to block, you're not receiving it through the complementary medicine or the supplement. I saw that in a case of a pancreatic neuroendocrine tumor. So be careful that you're not supplementing the hormone that is actually keeping your cancer alive or cancer growing. And we are trying to learn more about neuroendocrine cancers, and that's why clinical trials are so important. If you are considered to join a clinical trial, you need to be also very upfront and make sure you notify them about any supplements, or any procedures, or any techniques, because that can jeopardize the opportunity to be in a clinical trial, or if you're in a clinical trial, that can actually affect your outcome in the clinical trial. So we have to have an open communication. I want to thank all of you. Um, Open communication. We need to be careful, financial toxicity. And if you have any questions, feel free to reach out to your doctor, to your pharmacist, or to me if you're available. Thank you, everyone.